Welcome to Good Sex at NYU, a podcast about sex, relationships, health, and mental health in a sex-positive space. So if you're looking for sometimes serious, sometimes funny, and always sex-positive discussions, then you're in the right place. I'm Danielle Elliman, Associate Director of Sexual and Relationship Respect Services at Counseling and Wellness Services. I use she, her pronouns.
And I am April Fellers, a nurse and sexual health educator at the Student Health Center. I also use she, her pronouns. We are two white, cisgender, heterosexual, female-identifying clinicians, one with a medical background and the other with mental health experience, who seek to create a space that is inclusive of all identities, backgrounds, and perspectives. Today on Good Sex at NYU, we are joined by our colleagues Genny Cuocci and Akinola Adebisi. Genny is the Assistant Director of Clinical Services and Group Programming at Counseling and Wellness Services, as well as the Substance Assessment Feedback Evaluation, or SAFE, team leader. Genny has been at CWS for 6 years, and prior to this was the Program Director at an outpatient program for adults with substance use disorders in Manhattan. Genny worked in addiction treatment for 10 years prior to coming to NYU. This semester, she is also teaching a class at NYU's Silver School of Social Work on substance use and co-occurring disorders.
And Dr. Akinola Adebisi is a Senior Psychiatrist at Counseling and Wellness Services and a Clinical Assistant Professor at NYU School of Medicine. Dr. Adebisi is also part of our SAFE team. He has been at CWS for 6 years, and prior to this was Outpatient Director at Kings County Hospital. So today on Good Sex, we're going to be talking about sex and substance abuse. This is a broad topic, but we hope to have an informative conversation with two very experienced clinicians on the subject from the Student Health Center. So thank you so much for joining us. Can you share a little bit more about how you came to specialize in the area of substance use?
Okay. Hi. Thanks for having us. So how I came to specialize, I got my bachelor's in psychology and was sort of like, I don't know, what I want to work with, and then started volunteering in New Jersey at an adolescent outpatient substance use clinic. And I just felt like the treatment world dealing with addiction was very familial, and it was really kind of like informal in a lot of ways, and just kind of like learning how to like be together as a community and learn social skills. And I really fell in love with that. Had some personal struggles, had some family issues, family members who were really plagued by substance use issues. And I just felt like at home in terms of like starting to work in that area. So that's really how I came. I went to social work school. There were professors that really inspired me in the area, and sort of went from there and worked in the treatment world, as you said, for many years. So then if I fell into this role at NYU quite organically, I've been working with students and enjoying that ever since for 6 years.
Yeah, that's great.
Thank you for having me. Very happy to be here with both of you and Genny. When I completed my residency, my first job as a psychiatrist in America was in a prison in Pennsylvania. This was a medium, low security prison which focused mainly on people with mental health. It was essentially the state hospital where the sick patients of all the prisons were sent to for treatment. And while the patients there didn't really have the opportunity to use many substances besides the ones we prescribed them, it was very clear the impact that substances have had on their lives and continue to have their lives, even in the absence of them. And I think that kind of gave me some deep curiosity about the role of substance use in mental health, in psychiatry, and the fact that it really can't be divorced from the rest of mental health and can play such a big role in it. And I think that kind of had me just remain curious about it and keep learning and just make it a focus of the way I practice up to now.
Yeah. Completely agree. There are so many things that are so interconnected that we can't divorce them from each other. And I think substance use is part of that for sure.
Before we get too far, can we talk about some definitions, maybe what it means for someone to have substance abuse issues, and, kind of think through this fine line between what's a problem because it's impacting somebody's life versus society saying that certain substances might be quote unquote wrong or illegal.
So, when we talk about definitions in psychiatry, we usually refer to the DSM, the Diagnostic Statistical Manual, which is essentially our Bible for definitions of disorders. And I'm just going to go through some of the criteria which we consider for substance use disorder, and it kind of helps to give an idea of how that differs from regular, if you call it that, substance use. So some of the ideas are the sense of taking substances in larger amounts or for longer than you meant to. And I think many of us can relate to that. You wanted to have a couple of drinks or a drink at one night, we would say that's normal. And then the idea of, just drinking till you wake up in the morning and never knew when you stopped suggests that that was a little more than what you would want to do. Then wanting to cut down or stopping the using the substance but not managing to. That's also something that we see people wanting, making many efforts to try and stop the substance or the drug, and it's just seems to be beyond their willpower to do. And then related to that is spending a lot of time getting or using or recovering from the substances. And I think that's one that really, where you see the impact of people's lives in terms of, trying to get to buy or purchase or steal to find the drugs, and then, having the effect of intoxication, the high, and perhaps the period of recovery and hangover, and these things impacting that. Cravings and urges for the substance. So, sometimes we all may want to have a drink or something else, but having extremely strong urges that are really difficult to control and that really maybe impact your focus on doing other things, that could be something to think about. And then the impacts on your life. So not managing to do what you should for school, work, or home because of substance use, continuing to use the substance even when there are problems that it's causing in terms of perhaps your interpersonal relationships, family, friends, and also losing important parts of your life because of the substance. So your job or relationships, hobbies, all these things kind of because of the amount of space that the substance is taking in your life, that those other things start to fall by the side. Also using the substances again and again, even when it puts you in danger. Simplest example of that is someone with repeat DUIs. Being arrested once for drinking is pretty traumatic. So to have that happen again suggests there's this lack of control. And also continue to use the substance even when there are some health concerns, whether it be physical or psychological concerns, with alcohol, perhaps people having liver issues, with something like a stimulant like cocaine, people getting depressed after that high, and with these medical conditions causing you problems, but still not being able to stop. And then the ideas of tolerance, whereby to get the effect of the drug, you have to use more and more. So you see the escalating amounts of the substance used. And then the last one is the idea of withdrawal symptoms, which relates to the chemical experience or biological experience of the substance leaving your brain, and because of the changes in your brain from the substance, having some sort of syndrome of withdrawal. The commonest one we can think of is, the shakes that people can have after drinking.
That's really helpful to think about all those different things. And as you're going through it, I was like, oh yeah, that you can see clear, like, and obviously not everybody has all of those things, but just knowing that those are some of the big signs.
Yeah, and I want to say too, a big word here is a pattern of these behaviors, right? If someone has like just one of these and in the kind of isolated time period in their life when they're struggling, that may not indicate. But if you're continuing to have the pattern of these behaviors, I mean, even DSM like kind of qualifies it as like 2 or more is considered mild. 3 or 4 is considered a moderate use disorder. But really, if you're continuing to have these patterns and you're continuing then to use the substance, you not make like a change or you're having trouble stopping the substance or trying to cut back, or then it would be, indicate. But also, sometimes those are using substances or misusing substances are the last to know they have a problem. So are other people kind of constantly commenting, it seemed like you were in trouble last night with drinking, or it seems like, maybe you went a little too far. That's a big indicator, I say, too. Just something to kind of pay attention to. And again, a pattern of people telling you, not just like, oh, last night you were really messy, but like there's this continuing to happen.
Yeah, I feel like it gets harder as, like I think it could be easy at the beginning to kind of like joke with your friend of like, oh, last night you had a little bit of fun. But once you start, like I can say from personal experience, like once you see patterns over and over, I think it gets harder to bring it up to the person without wanting them to get defensive or. I
was going to ask if you had any advice for people who notice that, how they can, because I don't think that someone else is probably going to have a huge impact on the person, be like, oh, now I realize I have a problem. But I think I see it. I have a personal friend of mine who's going through it. And so how do I continually approach that I'm concerned?
Yeah, it's a great question, and we actually, and we'll probably get to that, we actually have a workshop at Student Health Center about talking to loved ones about maybe their substance use issue as well as their eating, concerned eating patterns. But I would say always starting with what your feelings are about the situation, where you can, I'm concerned about you, instead of identifying hey, you looked really messy last night, or necessarily saying but the behaviors that you see, but really or this is what I see and this is how I felt. I felt unsafe with you. I felt, concerned about you. I felt sad about this. Just kind of keeping it on your personal experience. I think that impacts people more than just stating what you were doing wrong.
Yeah, or even coming to them with the claim that we know that you have a problem, right? To say, I know that you're an alcoholic. You're an alcoholic. I don't think that's
Avoid
really
labels,
helpful. Yeah,
sure.
I don't think that's really going to be something that they're going to listen to and really hear.
I think people have to come to it on their own, but the labels are never helpful.
Yeah. Go ahead.
That idea of really trying to kind of express concern, I think, because the natural response is to be very angry or afraid, and that shows as anger about people that we love who are living in a dangerous way. And so how we can talk to them about, I'm coming to you from I'm concerned, versus the labeling or the hostility, which, doesn't really help. And then I think Genny really hitting it on the head of trying to kind of come to it from your perspective. I think that's really good.
And I'll say this probably again and again, but we're kind of always planting seeds. It may not work the first time you say it, but to say nothing, even though it may be scary, like April said, I think at least just saying something, at least plant some seeds maybe for future changes.
I like that planting seed. But I think what we're also talking about is some of the sort of myths and norms that come up in all of the work that we do, but when it comes to, use of substances. And you said not to use any labels, and I think that's really helpful. But are there other myths and things that we should unpack in this space? Because often what we like to do in this space is to talk about them and sort of counter some of those messages. In the world of substance use, what are some of those myths and misconceptions?
Yeah, I think we often see, maybe people harming themselves with substances and think that they're that they're trying to get a rise out of people, or this is, intentional, or they're trying to make their own lives harder, or they're irresponsible, right? Because a lot of symptoms of addiction is hiding, sometimes having to steal because maybe you need some more money to get your substance of choice. Again, back to the hiding, just these kind of lying, and just these behaviors that are really hard to be in relation with, if you're seeing this. And I really call them symptoms of addiction instead of like these are behaviors that people are choosing to do. So that I think this common myth that people that abuse substances are immoral or they're bad people. Oftentimes legal issues are associated with substance use behaviors. So it was actually taken out of the newest DSM version that legal issues are no longer a criteria to meet substance use disorders. But yeah, that people are just trying to these behaviors are just actually a choice. I think that's a common myth.
Yeah.
What else?
So I think, it's also along that idea is the fact that you can use your willpower to beat addiction. And I think that's really what prevents many people coming into treatment, because they feel that this is just a personal failing, moral failing.
Yeah, why do I
And
need
I don't need it. I just need to try harder. And, we all know this definition of insanity, which is doing the same thing a million times and hoping for a different response. But people do get caught up in that, and people around them do get caught up. And we do know that this is a brain disorder at this point, that there are certain changes that occur if they were not there originally, certainly after you've been using substances for some time. There are certain brain changes, and this requires treatment, and people can get better with treatment, but it isn't often as simple as, buckle up and take care of it. Another myth is this idea of rock bottom. We can't do anything until, he hits rock bottom, or until I hit rock bottom. And the fact is that people really don't need to hit rock bottom before they get into treatment. People can get into treatment at any time. Early in the use, we see people who perhaps were, in the university setting, they had one episode of a blackout, or, behaved in a way they didn't in school, and that brought them into treatment. And they were very early. They may have just started their substance use career in their freshman year from coming from home. So treatment can start at any time. And we do know that addiction isn't any different, that the longer you've been doing anything, the more it tends to kind of run tracks, deeper grooves into your brain, literally, metaphorically, and therefore it's harder to treat. So as with anything, from hypertension to cancer, the sooner you start to treat it, the better. And that also kind of goes to this idea that it's the other way that people may say, it's a disease, so you can't do anything about it. But that's also not true, because we do know that there are treatments. We know that there's psychosocial treatments, there's therapy, there are groups, various types of medications that can help. And just in terms of overall self-care and awareness, these things can all help. So we don't want to say that, this is a disease and you can do nothing either. There's no need to be fatalistic about that. That's really not true. Along with the idea of it being, though, it's a lifelong process. You can never get out of it. That's also not true. It tends to be a chronic condition if it's severe, where it can come and go. But people can be, if you go to AA, you hear this it's often to hear, I've been clean for 15 years, 20 years, 30 years. So while the tendency might be there, it isn't lifelong in terms of how it presents. People can be absolutely functioning and free of substance for a long time. And the last myth, which relates a little to the legal piece that Genny had mentioned, is the idea of people, if you force them into treatment, it won't work. And we actually know that's not true either. If people come into treatment, the idea is coming into treatment. When people come into treatment, some people will do better. We're not going to say everyone will, but how they get in doesn't seem to matter, whether they voluntarily do it or they're forced to.
So that means that even people that go there by choice might not be successful.
That's
correct.
That's the reality of life.
Yeah.
What do you think is the most common types of substance use concerns that you encounter at NYU or within your work at the Counseling and Wellness Services at NYU?
Yeah, 6 years ago when I started, it was definitely alcohol was like the main thing. Now, with various laws changing and just environmental factors, I would say marijuana is probably at the top. Maybe alcohol and marijuana together. There's also a rise in psychedelic use for sure that we're seeing. Do you agree with that?
I would say for sure that marijuana is the commonest one that we see. Alcohol obviously has always been there, but I think marijuana, particularly, and there is data to support that, with the legalization of marijuana, there has been an increase in use, particularly among younger people. So, yes.
Yeah. And we're talking about this in the frame of, potentially having some concerns or challenges with usage. Like, what is healthy usage look like? Because I feel like a lot of people are engaging in alcohol use, they are engaging in marijuana and maybe some other use, but I'm curious, like, what on the flip side would be healthy?
Yeah, I'd say not relying on a substance to self-soothe. I think I really see this condition as when someone is really using substances to self-soothe or change their mood. Then there may be, something to look at. But so not relying on the substance, maybe using definitely with other people and socially, and not having a pattern of maladaptive behavior associated with it. So what does that mean? There's no consequences stated. After a night of use, you feel okay, yeah, that was a good experience, and I don't have any lasting consequences. And socially, feel like we acted appropriately, and just making sure that you have other ways to cope with symptoms. Occasionally one may say, "I'm stressed out, I'm going to go have a few drinks." That may be okay, right? But if there's a pattern of that's the only way that you kind of relax, or there's that you continue to go back to that, I would say that's something concerning.
Yeah, I think, Genny, you hit that on the head away in the sense of the voluntariness of it. I don't know if that's a proper word, but the idea that it's something you choose to do versus a sense of a compulsion, which I think goes to this idea of a maladaptive coping. This is the way you use it. This isn't a definition per se, but I generally ask my students, how often do you use? And some people say 4 or 5 times a day. Okay. And some people 4 to 5 times a week. Some will say they use it every day. And I raise that question to them. If this is something you have to do every day, what do you think of your relationship with it? Because I think that is indicating there is not really a sense of freedom or option at that by the time you use something every day.
What about just pushing back on that? When you were saying using it every day, I was just thinking about people that drink coffee all day, every day. And the reason a lot of people drink coffee to help them stay awake and to get work done and whatnot. And so what if somebody is saying that they use marijuana every day to help them calm down or go to bed
or a glass of wine at dinner every night?
Yeah. So what do you feel is there a difference between those and how do you help students kind of think through that?
I go back to the relationship you have with it. How much are you relying upon it? And say your routine for some reason got out of whack, right? And you didn't have, you were out to dinner at a different place and there was no wine to be had. What would it feel like, right? What would that feel like? Or say even your coffee consumption, coffee is interesting because many of us, I drink it every day. If I weren't to drink it, I'd probably get a headache. And that would be somewhat concerning, maybe something to look at. But yeah, or your routine gets such that you're not smoking weed in the evening to relax. How would you feel? Would that, And that's a good question to ask to people sometimes, even if they're feeling this is really not an issue. But I like that issue, what you brought up, Akinola, about every day. What does that mean for you that you feel like you have to use you have to use the substance every day?
Yeah, and that's a good point. I drink coffee almost every day too. So I see, I can see that argument. I think we can come back to the idea also of the idea of consequences, right? I drink my coffee each day. to help me stay awake. What other effects does that have on me? In addition to the fact that I use it every day. So I think that idea of maybe every day and the consequences maybe is a better match or link.
Yeah. Like if you drink too much coffee, then you're shaking and you can't get any work done.
The other thing is sometimes people ask me, can there be healthy use of, say, heroin or some of these drugs that one could die the one time using it? And, that's a hard question to answer. And I could still come back to like, well, is there consequences from, honestly, I don't know anybody that uses heroin once a year, but, it's so sort of addictive and kind of powerful. But, there may be people that use it every once in a while. And again, like, are there consequences for you? Are you so concerned that, something bad is going to happen every time you use? That to me is a consequence. Sometimes we're talking to students and we're helping them identify some of these concerns that they didn't necessarily know that they had, or maybe they were just sort of like pushing aside. So I don't know. Yeah, I think that's important to know too.
Well, and you said that you're seeing more psychedelics. Can you share a little bit more about like how that's showing up and like what are some of the concerns or warning signs that might be something as
I think that psychedelics are more being used and are in media and even in research and being used for different conditions such as depression. And with that comes more awareness to the substances. So I think that's one thing, more availability because of that. But I think too, we went through this. We're going through still this pandemic. There was so much isolation. I think that caused an increase in like marijuana use, but also in a need to like escape and to get out of our own reality because our reality may be scary. Certainly there's a lot happening recently as well in the world that causes a lot of fear in people. So I think one of my hypotheses is that this need to psychedelics, if you don't know, kind of causes out of body experience, sometimes this altered reality. This hallucinatory effect. So certainly seeing individuals wanting to escape their reality and be in different states. So that's one hypothesis I have about that. But also as we see like ketamine being used for depression or mushrooms or MDMA being used for different conditions as well, trauma, depression, it gives more awareness to them. And so those who are maybe prone to abuse substances get more curious about it.
And maybe experimenting on their own instead of going into a clinic that is focused on that specific type of treatment.
Right. Yeah. Right.
Well, at this time, there is, in terms of psychedelics, you can only get truly treated with that in a research setting. So there is that limitation. But yes, there is there's the second dawn of psychedelics and in psychiatry, and it's really being explored for different substances and, on a parallel line, I think, among the community, people are trying it. I don't know that there's much evidence for that treating psychiatric conditions with personal use, but some people are using.
Microdosing is becoming more popular for sure, and these are all things that could be concerning, or it could be okay for people depending on how much information I think they have about it, how much you educate yourself.
And so you mentioned heroin, but I guess I feel like things like Molly or cocaine or like those are things I hear people like included with alcohol or whatever, or like in a party setting, it's much more limited and like not every day, just kind of like I do this on the weekends when I go to a party with my friends. And is that something that you also like, it sounds like from what you've said before, it's sort of like the impacts of that and does it have the negative consequences and those kinds of things. But is there anything else, those are quote unquote illegal in this country to obtain. But aside from that piece of it, do you have like, what are the conversations around those kinds of party drugs with students?
You're asking like what would be some like kind of safe practices to be able to like share? Yeah.
Or some concern, like when it would become concerning. I think you've kind of answered a lot of when it might become concerning, but I guess in terms of safe practices.
We can talk, to this point, we can talk about underlying mental health issues that some may be having. And if you're self-medicating with some substance, but you're not really treating your trauma, your anxiety, your depression, and you're just using these substances, that can really be concerning. So I would say, we want to make sure that you're treating your mental health issues with professionals, right? With the help of professionals, and not just being able to treat. I think people who use substances can be really creative, right, about playing your own doctor, and so just making sure that we're not trying to treat some symptoms on our own is something that I would say would be helpful advice. And I think too, like, what's the setting, right? What's the setting that you're using in? Are you in a good space before you go into, say, a psychedelic trip, or even a night of drinking, right? What's the, how are you going into that evening? Because substances can certainly exaggerate some of your already underlying feelings that are going on.
Mm-hmm. Well, and I'll just add in, I think it's also important to talk about sex in this context.
Yeah,
I feel like sometimes when we're out at the party and we're engaging in any kind of substances, sex might come up. And so I think that one of the things that I often talk about in my work is that, substances are a risk factor and not an underlying cause of sexual and relationship harm. But I think that gets really, dicey and a little bit gray, because if you have a lot of substance involved in a situation, then there is a greater risk that someone could, experience harm. But also it can help with the anxiety and with some of the things that come along with any kind of social interaction. But I'm just wondering if either of you have any comments around sex and substance use.
Drug, sex, and rock and roll.
Exactly.
Okay.
They're commonly linked.
Yeah, right. So, in terms of substances and sex, one can look at the different phases of, the biology of sex, and look at where substances the roles they may play in that regard. So you have things like, you start with libido, your general desire for sex. And drugs can certainly have an impact there. Certainly stimulants can kind of increase our desire for that in certain regards. And I think what one can see, and I'll just kind of in a general sense have the sense of, there are the effects of substances acutely that we've used, say, at that time, and then the impact of them over extended continued use. Mm-hmm. And those tend to be very different. Mm. So, for example, in the idea of stimulants or cocaine, increasing your libido at the time of, at the one-time use. But if it's being used all the time, you actually can have what we call like dopamine depletion. Mm. So sort of like the dopamine being this hormone that is responsible for sex, drugs, and rock and roll. That's our pleasure neurotransmitter. The levels can actually go down with, it's almost like you're kind of flagging a horse to the point where it's just not there. And and you can see people who are chronically addicted to cocaine, perhaps not really having very high libido. So, but yes, in that regard, it can affect that. And arousal, of course, can be affected by different drugs in terms of, the idea of erections and lubrication. Mm-hmm. These things can also be affected by certain drugs at a certain time. Certainly alcohol, subjectively, people report that they feel that it helps those things. Mm-hmm. When it's been studied, not so much. Mm-hmm. So, I guess, sex for more than anything is in the eye of the beholder or the person who's doing it. So, yeah, there is a difference sometimes between what people are experiencing and what may actually be happening. Orgasm can also be impacted by certain drugs as well. So those are kind of all the phases. What you do see, I think outside of that, the idea of the issue of consent, which you raise, mm-hmm. How can substances impact that? And, I think for the most part, we take drugs because we want to change some part of our mental state. And a large part of that is what we call our executive functioning, our planning, our assessment of risks, and our judgment. So, and that's, I think, impacted by many things. Certainly alcohol, we know that's a big issue with people unfortunately having bad experiences. There are drugs that are known as date rape drugs like GHB, gamma hydroxybutyrate, which are used for this idea of, slipping somebody something to put them in a state where they can't truly consent. So just to say that there can be significant effects with sex, with different drugs, and in terms of the impact on itself and consent. But as we said, people do use them and do feel a positive effect for them. The alcohol, the initial amount of alcohol, the very first few milligrams before you've even had half a drink, is reducing some of your inhibitions, which kind of makes you have that more social affability, and that helps to kind of, I guess, get you in a situation where sex can occur more easily. But probably somewhere after the first drink, you're going beyond that to a point where it's now may be impacting your judgment. So, I think, like everything, small amounts and being very careful is key.
Mm-hmm. You really covered a lot there, yeah. I mean, I can certainly understand, right, wanting that social lubricant going into some anxiety-provoking situations, or maybe sex is complicated, maybe there's past trauma, maybe you just want to, have performance anxiety. But yeah, you want to make sure that we're trying, just not taking too much of the substance where you're just not even experiencing or having a blackout, or you're not able to be yourself. So it's a complicated thing, but
I agree. And I think in order to have good, healthy, consensual sex, we need to have that executive functioning. We need to be able to assess the risk and be able to communicate. We talk a lot about in here, the whole purpose of our podcast is to destigmatize sex so people can talk about it. And if you're overly intoxicated, then you're going to lose so much more of your ability to communicate effectively. Even just to get consent for sure, but to say what you like, to say what's working, what's going on for you. You're not able to be as articulate, at least I'm not. So it's a matter of like, okay, do we want to, have really good sex, or what's going on for us in this moment?
How does sex come up in conversations with your students? Or does it? So
I think one of the ways that sex does come up, and I'd say it doesn't come up as much as you would think. And sometimes I have to tease it out.
Yeah, for sure.
But I think erectile dysfunction or concerns around that is certainly something that I hear when talking with male students, and the idea of managing that. So that, that's a common request would be, give me Viagra. So, we want to kind of have a discussion. We're talking about having discussions because the idea is we really want to understand things. Often, certainly, if we're talking about the young, healthy population, there shouldn't be too many reasons why the body parts shouldn't be functioning in that way. And so we may be thinking more likely that there are psychological reasons, and anxiety being a big part of that. Or it could be other things. It could be other medications that have been taken, or ongoing substance use that, the connection just wasn't made. I've been using meth for so long. I've been, using an opiate for a very long time, which we know will reduce sex hormones, which will lower your, sexual desire and other parts of it too. But yeah, so trying to have that conversation to see what's going on and trying to address the problem per se.
I think too, something I see is when I'm working with someone who has a severe substance use issue, we're not talking about sex because they're not having sex, because the substance they're in a relationship with the substance, or maybe they're using a substance to avoid social contact or avoid having like these intimate experiences such as sex, which can be very intimate, very vulnerable. So we may not be talking about it, but sure, yeah. I mean, I think it comes up around just like working with students and have them sharing their experiences, and I sometimes have to pull it out a little bit of them because there's a lot of shame around sex, but it's usually when we do start talking about it, there's a lot there and a lot to unpack.
Mm-hmm. And when someone does come to the sense of awareness that they might have some issues or challenges with substances, what are some common like treatments or recommendations for how they can get the support that they need in order to work through that?
Well, at the health center, we have individual counseling, but we also are heavy in the SAFE team on having groups because, we are social beings and substances can often interfere with our need or desire to be social, or we can, replace our social needs with, substances. So group therapy is really, treatment of choice. Even if you go to inpatient treatment, you'll see a ton of group therapy being conducted, being able to share that experience with others, hear that you're not so alone, that some of the behaviors you're doing that may be shameful to you are being done by others. And also like the model of 12-step recovery is, in a group setting where peers are sharing their experiences. So I'm really trying to, as much as substance users and misusers can try to isolate and, use the substance so they can be in the environment, we really want to try to have reparative experiences. So really, things like group therapy, things like mutual aid meetings. Medication is also a huge piece that, I'm sure Akinola could talk about. Sometimes, we're using a lot of substances and you're depleting these happy neurotransmitters that are like these happy chemicals in our brain. So sometimes medications can be corrective and help the process of recovery for sure. Yeah, and I would say also like just peer support is a big thing that I push, finding other people that are dealing with this, maybe going to meetings or having social encounters where, why don't we go out and have coffee, or why don't we, which is a substance, yes, but why don't we do something else, something alternative where there are no substances involved?
Yeah, I agree with Jenny. Treatment can be multifaceted, but I think the connection with someone in terms of a therapeutic part of the treatment is essential. Medications can be helpful. There are medications that are indicated for certain substances like nicotine addiction, which we haven't really spoken about. Mm-hmm. Alcohol, there are medications for alcohol, there are medications for opiates. Certain things can happen can be helpful if people are addicted to downers like benzodiazepines. But yes, it's really a holistic experience, and the idea of groups and individual therapy is key. And I also mentioned this idea of, self-care, getting back to things, because as we mentioned earlier, some of the things it's the neglect. It's when other things start to get lost. That's kind of one of those warning signs. And so it's like, how can people get back to what they like to do? Mm-hmm. How can they get back to exercising, yoga, meditation? They used to like to draw. What's happened with that, And as much of that as they could do in a social sphere is key, because, I think connection is one of the great treatments.
Yeah, and people misuse substances for so many different reasons. So treatment has to be so multifaceted. It can't be one size fits all. Mm-hmm. It's a complex issue. We have to treat it with various different ways, really getting to know what's going on for the individual to be able to tackle some of the reasons why they go to that substance.
And also, given that we're talking about sex, sometimes couples therapy we can't forget about that, because, as we've said, it's beyond the casual use, and we really should emphasize there are millions, if not billions, of people using various substances, and they're fine.
That's a great
it's not a problem for all, but for some people it's pretty devastating. And just the idea of knowing where you are and getting the help that you need based on what's going on for you is important. I think one of the questions I did kind of I had thought about is, how do you prevent this? Mm-hmm. And, that's a great question, because even though we didn't really ask it, because I don't really know the answer, but we do know that, there's a family history. And we know that if you have a very strong family history, particularly if you have it on both sides, they're more concerned. We could say that maybe you're 4 times more likely to have a substance use problem if you have it in the first degree relative significant problem. So being aware of that, I certainly have students come in who say, "Oh, I know I have this in my family. I steer away from it." That's their choice. And also just kind of knowing what kind of personality you have. Some of us know that we're kind of like, hear these words, people say they have an addictive personality. And I think there's some credence to that. Some people know they have a tendency to get onto something and not stop. And, if you know that, then I think that also kind of can play into how you try and manage yourself.
Yeah, I agree. I mean, there's research that if you have, childhood neglect or childhood trauma, there's lower levels of like serotonin, right? So we have to look at those. What is the childhood experience, and also if you have a parent, right? There's a theory that addiction's a learning disorder. So if you have a parent that has been abusing substances during your childhood, during your upbringing, or that's the way that you learned, right, how to kind of cope. You saw this. That's certainly a risk factor. That's an indicator. And then also access, right, is a big risk factor. If one has access, is around substances growing up, or when they start forming this social identity and this identity as a young adult, and there's access to marijuana, maybe it's, around in your high school, whereas others may not, have the access to it. They're going to, if the earlier you use, while the brain is still developing, the more propensity to form a issue with substances.
Yeah, I think that's really helpful. One of the things that I like to frame, prevention of sexual assault is really around like the underlying root causes and the risk factors and the protective factors. And so I think some of those risk factors, knowing them and being able to make an active choice whether or not you want to engage in any kind of action to have, exactly. And I think that we've also talked about some of the underlying root causes of someone who might experience substance abuse issues, right? So some of those mental health issues, some, other things that, could potentially put us at greater risk of engaging in substance use that is harmful. Mm-hmm. So I'm glad you brought that up, Akinola.
What are some of the long-term effects? I don't know if you see those in our students. They're kind of here for short-term, but any types of long-term effects that you see in students, or just from previous work from substance use?
I mean, I think an ability or like trouble with socializing, right? If you're used to, using a substance to self-soothe or go on social encounter or to, go on dates, for instance, one of the long-term effects could be like a real barrier to being able to connect with others. Of course, there's also like a lot of long-term physical effects that can affect one. And also, like, as I talked about a minute ago with just if you're using early, right, teenage years, while the brain is still developing, there's going to be some impact. The brain is going to be restructured in some ways, right? They may not be able to fire dopamine or pleasure chemicals as much. So that could lead to depression later on in life. That could lead to, social anxiety disorder later on in life. So those are some of the things that I see for sure.
So there's been some research done from New Zealand, which was quite incredible. They followed people for, I think, 40 years.
Oh, wow.
And they were looking at various types of substances use and following them. And the one thing they found was that people who were chronic heavy marijuana users, even after they controlled for everything else, even separate from heavy opiate use, stimulant, just chronic marijuana users over that period of time had a 5-point lower IQ by the end of that study. So and one of the things I raised that because, as you said, these long-term use in our setting, these students are young, and we're not seeing them and the 40 years down in their career with a substance. But I certainly do see that cognitive limitations. I do see some impairment in thinking, in memory, motivation in people, some of the students who are chronic, heavy, daily marijuana users. So that can set in, I think, in the course of, by their 20s.
Yeah. And it's good to think about that because you're having an impact on them now, and they might be able to intervene before even more long-term impact can set in, I guess. But when does someone need medical attention for substance use?
So, there are certain substances that treatment often involves, if it's severe, the use of a detox. And those are often, we're talking about substances that can be physically harmful when you stop using them. And those are usually brain depressants. So our commonest one is alcohol. It's working on the GABA is the neurotransmitter system that kind of calms us down. And if you kind of think about that, and also other brain depressants like benzodiazepines, they are being suppressed. The brain is being suppressed by those chronically. And think of that as a hand that's kind of holding down a child, and then you just take it off, and then the child jumps up. And that jumping up is your brain overactivation, which essentially is having seizures. So we really want people who are using heavy amounts of brain depressants like alcohol or benzos to really consider medical treatment if that's become a problem for them.
Or if they suddenly want to stop.
Yeah, I used to work in the ER, and we would see quite a few people detoxing from alcohol, and it's a very strict protocol. Like you have to check every hour or 2 hours and give them medication, and the signs leading up to the seizures and whatnot, their heart racing, fevers, like those kinds of things, dizziness, all of that. And so, I think that's definitely a good time for the medical observation for sure.
Then, with opiates, it's not life risky in terms of stopping the medication, stopping those drugs, but the actual uses can be pretty dangerous in terms of, because it's also suppressing your respiratory system. And the idea, this is why we're all talking about Narcan so much, because most of the people that die from opiate use, it's from the respiratory suppression. They stop breathing, especially if they're taking other medications, other drugs with it, which is, I think, the other piece of when you should get treatment is if you're using many drugs at the same time. That, I think, is another big warning flag.
Yeah, I like that you brought up the Narcan because I'm trained.
Me too.
Yeah, I just wrote that down. I definitely want to give a plug for our opioid overdose prevention program. Any students or any staff of NYU community can get free Narcan kits. This is a life-saving drug that can not prevent, but can reverse an overdose. If you see somebody, even if you see somebody, on the street, you could administer that medication. But certainly it's good if you're using. And also it's included in these kits are testing strips for drugs like fentanyl and xylazine, which can be lethal, and you can test a drug before you use it. So this is all good prevention tools that we have.
And I think, can't the general population also access this if they go
through the
CVS?
I think most pharmacies, certainly you can get free kits by going onto the OASIS Office of Alcohol and Substance Use Services in the state. I had them mailed to me just by filling out a quick little survey. But there's a little training, too, at the Student Health Center on how to use it.
Yeah, it was really helpful. I went through it, and I think I might need to go through it again because it's been a while.
Yeah,
it's pretty easy.
I think it's pretty easy.
Yeah,
but
pictures
also
on the box.
On the kit, there's little QR codes you can just send. There's a little picture to use it too.
Okay, well, I haven't really even opened it. So I should probably do that too.
Yeah. And I've again, working in the ER, used Narcan many times. It's very effective, and it's a great way to
Yeah, and there's also a substance called xylazine now. That's a tranquilizer that's being put in substances, street drugs, to certainly watch out for. And we have testing strips for those as well.
Great.
I know we've been talking about various different, substances and addiction. Can you share a little bit more about addiction in general, if we've missed anything so far, but also are people who have struggles with substances also at risk for other types of addiction, like gambling or sex or other things like that?
I think the mechanisms of the brain that are triggered when we use substances are very similar to those when we're, say, acting with any behavior that's going to increase dopamine, right? The big D word in the field of addiction is dopamine. And, dopamine, what it really does is it trains the brain. When we get high levels of dopamine, it trains the brain to know that we like that situation, right? We learn that we like that scenario. We like how it feels to, say, get high on cocaine. And certainly there's pre-existing factors that may cause somebody to abuse cocaine as opposed to just maybe use once in a while. But when one has an experience like such as, orgasm or playing a video game they really like, dopamine is also being affected. So these mechanisms of the brain, if you have the pre-existing factors, or if you really, say you don't know how to self-soothe, and you start to play video games every single day, and that's the only thing you go to self-soothe, you may get addicted to that. Well, then it's going to be very similar to being addicted to, say, marijuana. Similarly, sex, and, there's porn addiction, watching, pornography and having that same dopamine release and other chemicals in the brain as well. But, certainly, if you're using substances, you can be at risk for these other, what they call process addictions, eating concerns, well-disordered eating, the need to kind of control one's eating, can release dopamine as well in a way that can be unhealthy for certain individuals.
We know that these conditions tend to go together, right, in many people. And, if we're going, as Genny was saying, if you go back to the idea of what's kind of the initial experience, or that's the foundation of these things, and the conditions, similar conditions would have the same thing. So it's certainly the experience of early trauma, which would make you more prone to substance use, could also make you more prone to other kind of forms of addiction. Whether it be to substances or sex and things like that, gambling, also, certain personality disorders, those which have issues with impulsivity, or attention deficit disorders, again, which is relating to just challenges with this impulse control. You can have the range of these different addictions also all coming together. And, there's been research shown that people who have gambling addiction are more likely to abuse substances, and those who abuse substances are more likely than the regular population to have gambling problems. And I think sex is also there, rock and roll.
Yeah.
Do you know if there's been an increase? Like, I just think about people that are addicted to their phones and get the dopamine rush from scrolling on social media. I know that's not really, we're not talking about that, but I was just curious if you all know.
I think that's, some people have said that, in years to come, we'll talk about cell phones the way we talk about cigarettes, the damage they're doing. But we really don't know. I think, this is relatively early in our experience, but certainly there are questions of, heavy use, particularly in children, having some impact. And, I think we have to watch the space. So, I think the best advice for now is everything in moderation, including your cell phone.
Mm-hmm. Oh, I just want them to get off their phone and walk in New York City. Like, come on, move. Don't be watching the video game while you're walking on New York City streets, but that's just me. Is there anything else that you feel like is important for us to talk about in this conversation that we've left out?
I was thinking about dating apps, in just the context of, trying to find a partner. And something that I know a lot of students do, or a lot of people I know, is you can put in your dating app profile, like what your relationship with substance is. Say you're not using, right? We have a lot of students who are in recovery or just substance-free by choice. And you can put that in your dating profile looking for someone else, There's, some of the apps I think have, like, do you smoke, do you use? But you can also say looking for somebody substance-free. And that can be like a good way to connect with others.
That's a great tip. I didn't know that.
Anything else?
People, the question of shame has come up, and I think we've tried to kind of rebut that idea. This is not a injury or an illness of lack of will, and people should, I hope, listening, if they have concerns, we are available to talk, to explore these questions, and people should not feel ashamed or in any way inhibited from looking into having a healthy life and a healthy sex life.
Yeah. Are there any groups you want to promote, or workshops you want to promote, or how to get connected at CWS?
Right. I mean, if you call the Wellness Exchange hotline, it's always the best probably way to connect. But, we have a lot of different services. And as I said before, it's a complex issue. People use substances for all different reasons. So we really try to tackle that and try to provide a lot of different services. So you can talk to us one-on-one. You can come to our groups, which we have one for with substance-free, our students' recovery group. We have one for harm reduction, just talking about your relationship with substances with other students, and a trained clinician as well. We also have these workshops that are information. If you have a roommate who's using a substance and you're worried about them, we have substance misuse information for family and friends. And we're also going to have a new workshop soon, just talking about relationship with marijuana, and just talking about how to use safely. The THC levels are getting higher and higher. There's different forms of marijuana, and there are ways to use it safely. And we want to promote that. And we want to try to avoid some of the risk and teach different ways to self-regulate and self-soothe. So we have a variety of ways to interact and to be social. So I think those are our services.
Yeah, and obviously, there's individually meeting with, besides the groups, we have individual sessions with our counselors, with our psychiatric providers, mindfulness groups. I think those can be really helpful. Also,
right, trainer, replace some of maybe the reasons why we use substances with some other skills, DBT skills, mindfulness skills.
Yeah,
for sure.
That's great.
We have a Growth Through Connection group, too, which could be a healthy alternative for undergrads, graduate student support group. I mean, if you go on our website, we have various groups.
Yeah, Jenny's also our group team leader as well, so she's our expert in
My
groups.
email's on the website, so I love just talking about different options with students if you're not sure about which service could be helpful for you.
Well, right, and you may not come in thinking that you have substance use issues, and so maybe it is the mindfulness, or maybe it is the Growth Through Connections that get you linked, and then you can find a community and start to unpack what some of those real issues are.
Yeah.
How do they get to the group?
Yeah, so you can call the Wellness Exchange hotline. My email is on it. You could call the main counseling line.
Sorry, the group schedule in terms of knowing what's available.
We'll make that available on our podcast website.
Okay.
So that way they can easily link to that.
Great. It's on the CWS website as well.
It's on this. Yep. It's on our counseling and wellness website. If you just Google NYU group counseling, it'll come up. Yep.
Awesome. Yeah. Well, thank you so much for being here today. This conversation was very helpful. I learned a lot as well, and hope our listeners did too.
Thanks for having us.
Thank you.
Thank you very much.
If you have questions about the podcast or anything we talked about today, please feel free to reach out to us at goodsex.podcast@nyu.edu. This email address is monitored during business hours and may take 3 to 4 days for follow-up. We are definitely open to critical and thoughtful feedback, as we didn't cover everything in this episode and might have said something that was inaccurate or that had a negative impact on someone. If you have questions about your sexual health and are an NYU student, you can connect with our Student Health Center sex expert at sexpert@nyu.edu or schedule an appointment through the Student Health Center portal. Look at our show notes for additional information and resources, including organizations, articles, books, and videos.
If you have urgent mental health concerns, safety issues, or you are worried that someone might have caused harm to you, or that you might have caused harm to someone, then you can contact NYU's Confidential Wellness Exchange at 212-443-9999. Chat with them using their mobile app or email them at wellness.exchange@nyu.edu. For anyone, NYU or non-NYU listeners, you can call the National Sexual Assault Hotline at 1-800-656-4673, the National Domestic Violence Hotline at 1-800-799-7233, or the National Mental Health Hotline. Simply dial 988 from anywhere in the U.S.
Thanks for listening, and tune in to our next episode where we continue to talk about good sex at NYU. Subscribe to the podcast to hear all of our quickies and interviews with NYU community members. Thanks to our content contributors for this episode, Bernadette Kerr, Alyssa LaFosse, Dr. Dominic Baini-Amisa, Zoe Raguzios, and to our health promotion team, Anna Genova, Jenny Mellum, Parade Stone, and Arna Dixit, and to Gotham Studios and Karen Ortman.